I really would like to see more independents elected, which I actually think is easier than building a new national party. So, you know, when you have someone like Senator Sanders from Vermont, you have someone who doesn't hurt the Democratic Party in any way. He's actually better than most of the members of the Democratic Party, at least in the Senate, and yet, you know, had to work with the Democratic Party in some ways, but to some extent is independent. And that's the direction I would most like to see us move in. And I know it's not the most popular position, but it's one that I try to explain and advocate in my book. There were some, yes ma'am?
I think that single-payer systems is going to exist here in Ohio without perhaps a lot of people realizing it, because what they're going to do for everybody who retired from the state, any state agency, as of January 1, 2010, they're going to roll everybody who is Medicare eligible into a Humana system and make it a single payer system. And I don't hear any public comment because it's a done deal. I don't know anything about Humana as an insurance carrier, but I think it's going to be very interesting to see when people begin to go somewhere with a Medicare card to find that they can no longer use it because it's become invalid as of January 1, 2010. If you are a retired person from the state of Ohio.
Yeah, but you have Medicare first, don't you?
They're rolling Medicare, everybody on Medicare. If you're on Medicare, you're 65, and you're a retired state employee, you are not going to have as primary insurer Medicare. It's going to be Humana who's taking over Medicare. Did you not get in? Are you a retired state employee or something?
My wife is, and I'm on the plan.
Or do you realize what's going to happen?
I did not realize that.
Okay, well the letters are coming out and the explanation hasn't arrived yet. But as of January 1, 2010, we're going to be a single-payer system in this state for thousands of people all over, not just in Ohio, because retirees from the state live in Florida, they live all over the place. It's going to affect absolutely thousands of people, and nobody has said anything about the fact it's a single-payer system.
Well, not nobody, but not
well,
most
I mean,
people who are.
you know, it occurred to me that nobody has kicked up a big fuss. And of course the unions are supporting this.
There are these efforts to, I was not familiar with what you're talking about in Ohio. It's very interesting and I'd love to learn more about it, but there are efforts at every level to privatize Medicare and then, you know, Advantage and Part D and so forth. And I think Congressman Weiner from New York has been doing an excellent job on these talk shows. He's been throwing out this figure recently. I think it's 41% of healthcare in this country, when you talk about Medicare and the military and so forth, is through effectively single-payer systems right now. So single-payer is not a completely foreign idea to the red, white, and blue. And I think it is important that people talk about that. And the discussions we could have been having these past months, if we'd been talking about Medicare and not about death panels, would be, you know, I'm getting emails from progressive Congress members every day, including today, refuting the craziest of lies about death panels and so forth. What pointless chatter, you know, when we could be talking about what you're talking about. Yes, way in the back. Yes, you.
I went to, had a meeting with Mary Jo Kilroy last Thursday, all by myself, and asked her about the Weiner Amendment and which she supported and explained why I thought it was important. And she wasn't that familiar with it for some reason, and she said, is this about the Conyers Amendment? And I said, yes, he wants to replace 3,200 with 676. And she said, oh, I couldn't do that. I said, why not? And she said, well, Conyers Amendment, the very first thing it says is that it's to include illegal aliens. And I was thrown off a little bit by that, but I said to her, look, my strategy is, even if it doesn't get enough votes to win, at least it'll be a strong message and it'll kick what's happening a little bit to the left. I said, you've gotta be thinking that way. And she was very despondent about the fact that maybe the president wasn't gonna support the public option, and she didn't know if she could vote for it if he didn't. And I said, the public option is a sham. And then I went back and I read the Conyers Amendment, and what it says is that health care will be available to every resident of the country. That's actually what it says. And so she's interpreting that as illegal. So then I wrote to her and I said, how could you let something like that displace all the good that would come from Conyers bill?
Right.
You know, please consider the Wiener Amendment. So we are talking directly to the people.
That's wonderful that you're doing that, and you should go back and talk to her again and bring anybody else here who's part of her district, and keep pushing her. That's
I
great.
will say, she was having heartfelt, I mean, she was really distressed over the situation. She's, you know, really wants something good for us, but I think she's afraid of losing her position. She said, I would have to really strongly consider the Republicans in Franklin County if I were gonna vote for the Wiener Amendment.
There you go.
I said, what about considering?
Didn't get you elected?
Yeah, but it was a very close election.
I think it would be,
She needs to hear from all of us.
Realistically, she's in a tight spot.
I think it would be advantageous to get people together and take a message to her directly and through the local media, that, you know, if we are going to have people clean up our trash and work our farms, you know, we really want them to have communicable diseases. Because that is going to benefit the larger society, right? And so, you know, we want, you know, public service workers with flu and, you know,
Tuberculosis.
right, tuberculosis, right, have a campaign for tuberculosis, right? I mean, hit her with how crazy it is, what she's talking about, right? I mean, it's wonderful that you're pushing her. You're the first person in one of these events, I've been to 6 or 7, that has said, oh, I did just speak with my congressmember.
Well, actually, some of the SPAN people have been there, the OCHC, a lot of people are, but it's like...
Well, it doesn't take too many times from too many people, so keep trying. There was somebody else. Yes, go ahead.
What do you foresee happening with the war in Afghanistan?
Well, the public has turned against it, a slim majority, which is a huge accomplishment. That many people in this... I'm sorry?
George Will came out against.
Yeah, George Will came out against
Will
it.
is
That was,
against having United States white Christian citizens on the ground. He wants to slaughter them with drones. So it is useful, it is valuable that George Will is for withdrawal. It's good for anybody to be for withdrawal. And if you can get Republicans to start favoring withdrawal from Afghanistan because they label that one Obama's war and Iraq is Bush's war, fine, I'll take anti-war positions any way you get them, you know. But the plan out of the White House, and Congress doesn't dare interfere, is to escalate. And I saw a report yesterday from a reporter with McClatchy who has done a better job than almost anybody else on these wars since the beginning, on Iraq, who knows that these wars are wrong. And he was embedded with U.S. troops in Afghanistan, and they were attacked and lost a few men, and air support never came, and they were unable to shoot on areas where there might be civilians, but he's sure there weren't, and so on. And he concludes by really wishing they could have got that air support. You know, the alternative to that is to get those ground troops out of there who, by his own account, were not doing anything sensible or useful, rather than having the air support to protect them. And inevitably, slaughter civilians. Not to mention